This one was suggested by Scott Snedden in our Flight Path Darts Discord server, because Scott's dealing with tennis elbow and wanted to know three things. Could it be a technique issue? Is it common in darts players? And what do you actually do about it without making it worse? Because darts looks gentle from the outside. You stand still. You throw 23 grams. You collect your darts. Job done. But your body doesn't count the sport by how dramatic it looks. It counts repetition. It counts tension. It counts how many times you ask the same forearm, wrist, and elbow tissues to do the same job. And when that load creeps past what your arm is happy with, that's when pain starts whispering, then nudging, then trying to take over the room. So in this video, I want to break this down properly. What tennis elbow actually is, whether your darts technique can contribute to it, what you should do if you've already got it, and how to lower the chances of it coming back. A quick disclaimer before we start. This is not a diagnosis for Scott or for anybody else watching. Elbow pain can have more than one cause. But if you are a darts player with pain on the outside of the elbow, especially if gripping, lifting, twisting or throwing makes it worse, tennis elbow is one of the big suspects. Tennis elbow, or lateral epicondylitis, is pain around the outside of the elbow, where the forearm, muscles and tendons attach. It often hurts when you grip something, move your wrist, lift with the arm, or repeatedly use the forearm. The annoying part is that despite the name, plenty of people get it who have never gone anywhere near a tennis court. It can come from repeated wrist and forearm work in sport, work, hobbies, tools, keyboard use, or a combination of all of them. So for the darts player, the first important point is this. It is not ridiculous at all to think darts could aggravate it. You're repeatedly gripping, repeatedly controlling the wrist, repeatedly loading the forearm, and often doing that for long practice sessions with very little thought about how much total stress is actually building up. Now, is it common among dart players? Here's the honest answer. I have not found strong dart-specific prevalence data that let me say, yes, this exact percentage of darts players get it. Darts just has not been studied like tennis, baseball, or other big sports in this area. But the mechanism fits. Tennis elbow is common in repetitive wrist and forearm tasks, and darts is a repetitive wrist and forearm task. So while I can't give you a neat dart statistic with a bow on top, it is absolutely believable. And it would not surprise me at all to see it crop up among regular players, especially people practicing a lot, gripping too hard, or carrying extra strain from work as well. Now we get to the bit Scott really asked about. Could technique be the issue? Yes, it could be part of the issue, not always the whole issue, but definitely part of it. The darts biomechanics research I found shows that most skilled players tend to keep the shoulder and elbow more stable, with less unnecessary movement, while the forearm and hand do the cleaner part of the job. That does not prove one exact pain pattern, but it does support a coaching idea that usually makes sense anyway. Extra movement means extra demands. If your throw is asking the elbow, forearm and wrist to constantly rescue the line, that can increase stress over time. That's an inference, but it's a grounded one. So here are the technique habits I'd be looking at first. 1. Gripping the dart too hard. A death grip turns a precision skill into an arm wrestle with tungsten. 2. Adding a big wrist snap to try to force power. Darts does not need much power. The harder you try to manufacture it from the wrist and forearm, the more likely those tissues are to complain. 3. Collapsing posture or dragging the line across your body. If the arm path is messy, some part of you has to tidy it up late. Often that ends up being the forearm and wrist. And 4. simply throwing too much with a technique that is just slightly inefficient. That's the cruel one. Sometimes it is not terrible technique, it is decent technique done 6,000 times while the arm is already irritated. So, what should Scott or anybody in the same boat actually do? First, stop trying to throw through sharp pain like you're proving something to the darting gods. The usual advice is not do absolutely nothing forever, it's more like relative rest. Reduce or modify the aggravating stuff. That means cutting back the sessions, reducing volume, and avoiding the things that really spike the pain while the elbow calms down. Official guidance also supports simple pain relief measures like paracetamol, anti-inflammatory gel if suitable for you, hot or cold packs, and in some cases, a forearm strap or brace. Second, do not ignore everything else your arm is doing. This is where loads of players get caught. They blame only darts, but then spend all day on a mouse, lifting awkwardly, using tools, or carrying shopping with the palm down and elbow straight. That is like blaming one rain cloud while standing in the sea. If you want the elbow to settle, your whole forearm workload matters. Third, once pain settles enough, start sensible rehab instead of waiting for magic. The usual rehab themes are stretching, wrist and forearm strengthening, grip work, and progressive loading. NHS and arthritis resources commonly include elbow bend and straighten work, palm up and palm down rotations, isometric wrist extensions, wrist stretches, and wrist lift exercises using a light weight like a tin of beans. Some resources suggest doing these for weeks rather than days, often 8 to 12 weeks, and some NHS leaflets say around 3 months to help prevent recurrence. For a darts player specifically, I'd keep it really simple. Step 1. Calm it down. Shorter sessions, less volume, no marathon practice. No ego sessions where you keep going because it'll loosen up. Step 2. Clean up the throw. Softer grip, quieter wrist, less forcing. Let the dart go instead of bullying it out of the hand. Step 3. Rebuild capacity. A bit of daily rehab. A bit of forearm strength. A bit of grip work. A bit of patience. The most unpopular exercise of all time. Now, one thing worth saying clearly. Do not chase every shiny fix just because the pain is annoying. The British Elbow and Shoulder Society guidance supports physiotherapy, especially in the short term, and says topical or oral NSAIDs can help with short-term pain relief. But it also says corticosteroid injections should not be used for tennis elbow because they may give a brief, early improvement, then do worse by around 6 months compared with placebo. The same guidance also says PRP may have no benefit over placebo. The surgery should be treated very cautiously because there is no clear evidence of benefit over placebo surgery. In other words, this is usually not a one magic procedure fixes it problem. The encouraging bit is that many people improve over time. The BESS guideline cites evidence suggesting a large majority improve or resolve within the first year. Although that does not make the short term any less annoying when you're living in it. Prevention in darts is mostly boring, which is usually how you know it works. Warm up before you start throwing properly. Not just one dart at treble 20 and a prayer. Get the elbow, wrist and shoulder moving. Throw easy for a few minutes. Build practice volume gradually instead of jumping from one casual session a week to a 3-hour tungsten pilgrimage every night. Take breaks. If you work a manual job or desk job that hammers the same area, factor that into your total load. Keep your grip pressure sensible. Keep the throw smooth. And keep doing some forearm strength work even after the pain goes away. Because stronger tissues are usually happier tissues. NHS and physio leaflets specifically point to modifying aggravating activities. taking breaks, using larger grips on tools where possible, and continuing exercise to maintain flexibility and strength. And from a pure darts point of view, this is the big one. Do not confuse effort with efficiency. The best darts throws often look calm because they are calm. Less excess movement, less panic, less strain, more repeatability. The same idea lines up with the biomechanics work comparing competitive and recreational players. Now, when should you stop self-managing and actually get it checked? If the pain is not improving after a couple of weeks of sensible self-care, NHS advice says speak to a GP or access MSK or physio support and get medical help sooner if there's a sudden injury, severe swelling, bruising, major loss of movement, fever with a hot red elbow, or sudden loss of power or feeling in the arm or hand. That's when you stop playing home physio and let a professional take over. So, Scott, the short version is this. Yes, tennis elbow can happen in darts. Yes, technique can contribute. But it is usually not just one tiny technical flaw. It is more often a pile-up of repeated load. Too much tension, too much volume, not enough recovery. And sometimes work or daily life piling extra stress onto the same tissues. So the answer is not to grit your teeth and throw harder. It is to reduce the aggravation, clean up the throw, rebuild the forearm properly, and be patient enough to let the elbow stop acting like every dart is a personal insult. And for everyone watching, if you have dealt with elbow, wrist or shoulder pain from darts, drop it in the comments, because the more we talk about this stuff, the better chance we've all got of staying on the oche instead of sitting there icing our arm like a disappointed cyborg. If you found this useful, subscribe to Flight Path Darts, and I'll see you in the next one.